Welcome to the Global Pulse, a short video series where our experts break down a trending topic in international business and why it matters to you.
The Indian experience has been both similar and different than in other parts of the world. Similar in the sense that it arrived with foreign visitors. For instance, in one prominent case, it was a group of Italian tourists. But now it's been spreading freely within the country. A large number of known cases are related to one large religious gathering in Delhi in March. But because of a lack of adequate testing, it's hard to say exactly how widespread the disease is and how fast it is spreading. For the last 3 weeks, the country has been in a fairly strict lockdown in an attempt to control the spread. This lockdown has been extended now by another 2 weeks. This is bound to have some effect, but social distancing is intrinsically difficult in a country as densely populated as India. In densely populated urban slums, for instance, it's hard to see how any meaningful distance could be achieved. But the Delhi government has attempted to identify and isolate streets and apartment buildings and restrict movement of people from within those areas to outside and vice versa. The pandemic has led to a large number of national restrictions on the cross-border movement of pharmaceuticals and medical equipment. And India is no different. The US government had placed a large order on a drug called hydroxychloroquine from Indian manufacturers before an export ban went into effect. There's some anecdotal but scant scientific evidence that the drug is effective in the treatment of COVID-19. However, President Trump is convinced that this is what he called a game changer, so he leaned on Prime Minister Modi, who released those shipments in a goodwill gesture, and a public tweet thanking him followed from the president.
As of April 13, Taiwan has recorded 388 COVID-19 infections and 6 deaths. From my observation, Taiwan is one of the many countries that were able to minimize the impact of the COVID-19 for these 3 reasons. First, Taiwan suffered from SARS epidemic in the year 2003. Since then, there has been 2 norms: taking body temperature upon transit arrival in Taiwan and wearing face protection masks as necessary as normal lifestyle. Second, transparency. As early as December 31st, 2019, Taiwanese officials boarded direct flight from Wuhan to check passengers for fever and pneumonia symptoms and order suspected patients into isolation. Health and travel databases were then integrated to trace cases. The Central Epidemic Command Center across various ministries was activated on January 20th in light of the COVID-19 outbreak. Since on January 23rd, a daily press conference was held to explain the epidemic situation. All actions were without imposing wide-ranging lockdowns. Third, community supports. Taiwan has valuable resources in public health system. By leveraging big data in health insurance database, IP-based PACE policy was implemented. The government actively cooperated with private media companies to regularly broadcast basic prevention knowledge, such as washing hands and wearing masks. For people arrived from high alert area, 14 days isolation and self-quarantine was imposed. The local government uses smartphone apps to check on the person daily and cooperated with private companies to provide isolation and hotel rooms for those who cannot do so at home.